good day to you, my dear friends and colleagues. We are practicing physicians, diabetologists, cardiologists, and we are privileged to do so because we are treating mankind with lots and lots of knowledge. The discussion what I had today was on one of the studies of Al-Heart. This was a study which was concerning about blood pressure and the various medicine, that was the chlorothalidone, which has been used to control blood pressure. Now this is the only study which has been done in a patient who has got a metabolic syndrome, who is obese. The condition of this study was that he should have an impaired blood sugar or a fasting blood sugar higher than 125, a patient who has got obesity, a BMI of more than 30, and having hypertension. So all fits into metabolic syndrome. And what medicine they had used? Alpha blockers, they have used calcium channel blockers, they have used ARNI, they have used ARBs. And ultimately what result comes is that to decrease and lower blood pressure, chlorothalidone is doing a very good job. And we have got lots and lots of comparison of chlorothalidone. Another part of this is, apart from decreasing the blood pressure, it also has got a longevity in life because it helps the kidney to function much better. A part of the subset of this study has been conducted which told about the statin use. And yes, with the course of time the statin use continued because the placebo arm also started having the standard of care and a lot of statin came into use. But even now till date, the control of blood pressure is one thing which is very difficult. We need to revise our guidelines according to what the international and national guidelines says. A blood pressure of 130/80 with a comorbid condition has to be achieved. All these trials, they are basically weapons in our hand so that we can use them effectively for treating our patients. So happy treating patients and have a great day ahead. Thank you.